Hello. In this video, I'm going to do a walkthrough of a higher demand question from the PISA literacy test, just to help you find your way into questions of this type, which are that little bit more difficult. Right, so in this question, we are going to, you see the focus is on this drug called thalidomide. All the details you need to know are written here, and it's important to try and read this and not necessarily remember everything, because that's too hard to do. So don't try and remember everything, because you can always come back, but do try and visualize and consider the statements and the facts that are being presented here. What we're trying to avoid here is avoid reading for reading's sake. So let's have a look. In the 1950s, pregnant women took a drug called thalidomide to prevent morning sickness. Just visualize that taking place. It had originally been used as a sleeping pill, but it also had this side effect of preventing nausea, nausea being feeling sick. At first, thalidomide was available without prescription, so you didn't have to go to the doctors to and for them to assign you this drug. You could go and pick it up from a chemist. Thousands of babies of mothers who had taken thalidomide were born with terrible birth defects, most commonly shortening of the limbs. It was discovered that the thalidomide drug binds to a protein called cereblon. I'm not sure how to say that, and I want you to know that, because me reading it here is just as uninformed as you would be. So it binds to a protein called cereblon, which is important in limb formation and stops cereblon from working. Mothers are no longer given thalidomide during pregnancy. Thalidomide continues to be prescribed to humans, and it is now known to be useful in treating leprosy and some cancers. Okay, so there's the setup of the question. If we've read that carefully and we've thought about what's been written there, hopefully that will be useful. So let's get on with the first question. So here's question 1. Thalidomide caused terrible birth defects by inactivating a protein needed for babies' limbs to develop properly. We know that already. Which of the statements below would be the best method of finding out that thalidomide would have had this effect? Okay, so here's our 4 options here. It says test whether thalidomide works to cure morning sickness. Well, this wouldn't be suitable in finding out whether the thalidomide would have caused the birth defects, as morning sickness itself does not cause the birth defects. So this kind of trial, if you were doing that, if you were to test whether thalidomide works to cure morning sickness, that would be looking at the efficacy or how effective the drug is, and not on the side effects of the drug. So it's not going to be A. For B, it says carry out research into the side effects of thalidomide. Well, this may pick up the occurrence of birth defects, but only if members of the research group included pregnant women or pregnant animals. It's always difficult to do that. Ethically, it's very wrong, isn't it? Because we're testing on pregnant women, and we don't know if there are some negative effects of that. So we look at C. It says, what about testing thalidomide on animals who are pregnant? Well, yeah, now this is the best method. This is the answer that we're looking for here. And why? Because we're avoiding the dangers of testing on pregnant women, and we are testing on animals, and we deem as humans, rightly or wrongly, that if animals or offspring, babies of animals are born with birth defects, that's less of a concern to us than if it's humans. And now we can you could argue whether that should be right or not, but that is what we do as humans to make sure that our drugs are safe to use on humans. So we want to test it on animals who are pregnant. That's a correct answer. And just to look at what the last one would be, test thalidomide on a group of young babies. Well, testing on babies wouldn't necessarily give the same effect as if we tested it on a fetus, a developing fetus inside the womb, especially if that harm is done at a very early stage of development. So it might even be safe to use on young babies, and it doesn't mean it would be safe to use on pregnant women and have those terrible side effects on the developing fetus. Not an easy question, okay, and this would be classed as medium demand. So we'll look at both medium and high demand questions in this presentation. You have to consider each one carefully and come up with what you think is the best answer. It's not the case that 3 are absolutely wrong and 1 is clearly right. You're looking for the most appropriate. It says what would be the best method of finding out that thalidomide would have had this effect, and that really is why this is a higher demand than, well, the low demand questions then. Right, so this next question then looks at the effect of, or the arguments for and against using animals for testing drugs. So the first question asks you to give one scientific argument that supports the use of animals to test drugs, and the second question on scientific argument against using animals to test drugs. It's a good idea, I would suggest. I'm going to run through the possible accepted answers here, but it's a good idea for you to pause the video and think for yourselves first. If you want to practice these questions, what would you write down for each, and maybe make a note of those. So let's have a look what is would be accepted here. So the first one, animals are similar to humans. So we can expect them to have similar responses to the drug. They're not identical to humans, but they're similar. So it gives us a good idea that if it's a problem for an animal, it's going to be a problem for humans. Similar idea, we can see if it's poisonous or toxic before giving it to humans. Same principle, we test it on animals first and find that out. We can see if there's any side effects before giving it to humans. It's the same idea, isn't it, those first 3. Slightly separate, or we can see if the drug actually works. So this is not about the side effects, but the drug is there to do a job, or that's what we intend it to do. We want to know if it's actually effective at doing that job, at treating a particular condition. And now let's think about what that means if we're testing on animals. Well, humans aren't harmed, and therefore had we tested on humans, it's possible humans would be harmed in that process. We've saved loads of human lives by using drugs which have tested on animals, and had we not, we wouldn't have all those lives would have been lost. And we're always going to need to do that. As things stand, if we want to develop new drugs, we need to be able to test them on animals. Those are the arguments for. The arguments against, well, the main one probably is that there's a good chance this is going to cause suffering or death to the animal. Okay, we're testing this drug to find out how harmful it can be, knowing that it may be harmful, so it's likely to cause suffering or death to the animal if it is indeed toxic. The next argument, well, are there other methods we could use, like computer simulations, to test the drug? Or do we surely testing on animals is not our only option here. Moreover, animals aren't exactly the same as humans. So whilst they give some information, it's not perfect. Think of chocolate and the way it's toxic to dogs and not to humans. We can't be certain that if something's safe on an animal, it's going to be safe on a human. And the drug might not actually get used. So an awful lot of drugs that get past the animal testing stage don't make it onto the market, don't get licensed, and therefore there's a lot of harm that's been done to animals that may have been needless. So look, you don't have to agree with all of these. It's not the point. The reason why this is classed as high demand is because you're being asked to see both sides of the story here. Or both sides of the argument, and formulate that into your answer. Right, on to the next question. It asks, initially thalidomide was not available without prescription. It gives that statement, but we saw that at the beginning in the first passage of information that they gave us. Why did the fact, here comes the question, why did the fact that women did not need to see a doctor before taking thalidomide increase the occurrence of thalidomide-related birth defects? Again, I would encourage you to write an answer first and have a go at this. So pause the video before I show you the answers, and then you can see how well you got on. So firstly, well, doctors may have known about possible side effects, and patients could have been informed about those and then been able to make an informed choice about taking the drug. But because they're just buying it from a chemist off the shelf, if you like, they're not warned about that. Moreover, if doctors prescribe the drug, they can then get some feedback, some information from their patients as to whether there's some problems with that drug. And on doing that, and this exists currently in medicine, there's a way of flagging up side effects that become apparent, and these are for drugs that are already licensed. Once they're used by millions and millions of people, you have an opportunity, doctors have an opportunity to sort of highlight when they think there may be some possible side effects. And as a result, if enough of those are reported, we can then inform patients, or perhaps even stop prescribing that drug. So it's not monitored in that way. Patients who buy the drug are effectively left to their own devices. Doctors would not know if a pregnant woman was taking the drug. So they have no idea. Similar idea, if they haven't prescribed it, they wouldn't have an idea whether a pregnant woman was taking it and couldn't advise them if perhaps they think they shouldn't. Because they don't know what's going on, and patients are free to buy it themselves, they're not going to be able to make that link between birth defects and the use of the drug straight away. It will just take an awful lot longer. Whereas when doctors prescribe it, they can see patterns very quickly, because when that patient comes in complaining of side effects, and that drug will be on their medical record, then doctors are able to put two and two together and see the pattern that's forming there. The lastly thing, people might think the drug's harmless and then not follow the instructions. So when you go to the doctors and it takes you, and the doctor prescribes a drug, they will tell you this is how you need to take that drug. And if you're able to buy it from a pharmacy on the shelf, you might not be as vigilant, concerned about how you take that drug. This is a high demand question. Again, it's free writing. That's what makes it more difficult. It's not an obvious answer. You've got to think carefully about this. Next question. Now is asking for your opinion. Why do you think the use of thalidomide was not banned, even after it was proven that it caused birth defects? Tough question. Again, it's a high demand. It's free writing. You've got to think carefully about this. Have a go at it. Pause the video. See what you come up with before we then check. That's how you'll learn better for next time. So what have we got here? Well, it did its job as a sleeping pill. So that's originally what it was used for, to help as a sleeping pill. So it did that job, and so people thought, well, it's good at what it does, and it did work as what it did. It also worked well to prevent nausea. So it's sort of doing the job that it wants. Pregnant women who had morning sickness heard that it was good for preventing nausea, so they took it. That might even have been word of mouth. They might have had friends who had taken it as a sleeping pill, and they found that it was good for preventing nausea, so they decided to take it themselves when they'd heard that. Another reason it's not been banned, well, it now has a use, doesn't it? So had you banned it, now it can't be used to treat leprosy. Just because it was negative in its use in pregnant women, causing side effects, it doesn't mean that drug can't be used. An awful lot of drugs nowadays come with warning labels not to be used on pregnant women, simply because they've never been tested on that, because it's an ethical issue of testing on effectively a fetus who can't give their permission to be tested upon. Lots of drugs aren't suitable for pregnant women, but they may well be suitable for other things. And thalidomide was suitable for leprosy. And also, same idea, it's now been found to treat some cancer, so it's the same principle. Last one, if we banned it, we would not know that it could be useful to treat other illnesses. Same principle, like leprosy, like cancers. Oh, sorry, there's one more here. And if we banned it, we wouldn't be able to use it as a sleeping pill, and we've established that it's useful as a sleeping pill. So this is, again, is a high demand because of this free writing. Tricky question, so don't beat yourself up if you found that very difficult, but hopefully you're able to see a way in there that perhaps you could have got there had you attempted that. And the last question we're going to look at. So doctors try to prevent thalidomide related birth defects by restricting its use to people who are not pregnant or likely to become pregnant. Despite this, some new cases of thalidomide related birth defects still occur. So it's a circle increase or decrease for each of these statements. So statement: women buy thalidomide illegally, e.g. over the internet, and as a result are not made fully aware of possible side effects. So, is the occurrence of thalidomide-related birth defects likely to increase or decrease? Well, in this case, you can expect it's likely to increase, isn't it? Because you've effectively got more people, more women taking thalidomide than should be, in the sense that they're not going to the doctor, it's not being prescribed, they're buying it illegally. Next statement. A person who is taking thalidomide to treat another disease unintentionally becomes pregnant. Well, of course, same principle here. Now you've got someone who doesn't know they're pregnant, but they're taking thalidomide to treat this other disease. That's going to increase the occurrence of thalidomide-related birth defects. And finally, the drug is now only available on prescription. Well, this is going to decrease the incident because of those things we mentioned earlier. The doctors are able to warn patients. They're able to let them know about those side effects. Might ask them questions like, do you think it's possible you might be pregnant? Before they consider prescribing that drug. This one is again classed as a high demand. I must say I don't think this is nearly as difficult as those previous high demand questions, but officially this is how it has been classed. Okay, so that's our last question we're going to look at. So the questions discussed in this video that we've just looked at are just some that appear in a collection of interactive PISA type questions that are available through Hub. So please do go to the Hub website and have a go at some of the other questions that are available, trying them out and comparing it to the mark scheme that's available too. All you need to do is scan the QR code with your phone, or if that's tricky, if you can't do that, type the long address at the bottom of this screen into your browser, and that should take you to the appropriate site.